Hi, it's Bobby Cobb with the Transformative Change Institute, and I want to welcome you to this video on the attention-shifting pain protocols. The last couple of emails, I've talked a lot about bringing the mind into our mind-body healing, and there's a lot of good reasons for doing this. Number one, it can significantly increase the results that you're able to deliver to your clients. And we all like that, right? I mean, we like a happy, satisfied client. That's a good thing. Here's the other benefit. This will allow you to do this with virtually no side effects. No side effects, you say? How can that happen? Well, because when the mind introduces something, it introduces it at the exact right amount, effortlessly, automatically, without having to be fine-tuned. It just knows. And that, to me, is one of the big benefits of bringing the mind into your mind-body healing practice. Quicker results, no side effects. And the mind is so powerful. That's why when they do these double-blind studies, they're testing the placebo effect, which is in essence the power of the human mind to deliver the results at the speed of thought. It's a whole different way of looking at it, and if you think about it, it's a pretty powerful differentiation between the way that they've been using this traditionally. In the past, what they've been looking to do is screen out results that are accidentally or haphazardly delivered and become the fly in the ointment in terms of a scientific research to figure out whether or not a drug or a compound or a technique or a protocol or whatever it is that they're testing is actually delivering the results. They're trying to zero out the mind. Here, what we're trying to do is zero in on the power of the mind and use it on purpose and by design in your practice with your clients. Here's a cool experiment that you can try just to see the power of what this has the capability of actually delivering. So in this little experiment that I'm going to suggest that you run, you don't need to know how to be a hypnotist. You don't need to even understand exactly what hypnosis is, because this is not hypnosis, what you're going to be doing here. Instead, what we're going to do is tap into the power of our unconscious mind and enroll it into the healing process. So we're going to piggyback a little bit on some hypnotic principles, some natural ways that the mind already works that hypnotists have just learned to hijack in order to enroll the unconscious mind into the outcome that we're looking to achieve. And that's something that happens all day, every day, literally, whether we're looking for it to happen or not. So for the purposes of this exercise, what we're going to be looking to do is work with pain and seek to use the power of your client's unconscious mind to reduce that, really for the purpose, so whatever protocols they're there to see you for, if you're a chiropractor for an adjustment, if you're an acupuncture for a treatment, or if you're a massage therapist and your client is just feeling needy. I do like massage. Any of these is an absolutely wonderful opportunity to give these protocols a try. Take them out for a test drive. They're easy, they're effortless, they're conversational, and they're completely in line with the Hippocratic Oath. You can do no harm. So anyway, step number one, we want to get them fully associated with their pain. This is normally the easy part. Really, all you have to do is ask them, so what's going on? How long does it hurt? How did you hurt yourself? How do you feel the pain? The goal in doing this, though, is to get them fully associated, meaning I want them to remember how it happened clearly. I want them to remember the last time that they felt in pain so they can actually be experiencing that pain now. We're going to take care of it, and we're going to show them that they have the ability to move around. But our ability to demonstrate this to our clients goes up dramatically if we can have them fully associated. So that's step number 1. So step number 2, we're going to ask them to quantify it. So we want it amped up a little bit. We want them in the moment. We don't want them remembering something. We want them to feel it right now. Step number 2, we're going to get them to quantify that for us. To me, the easiest way to do that is on a scale of 1 to 10, or if you prefer 1 to 100, where's that pain right now? Now, I don't really care necessarily what that first answer is. If they do happen to give you, on a scale of 1 to 10, I'm a 15, giant bonus. We'll talk about that in just a little bit, but we want to know where that is right now. That's step number 2. Step number 3, we're going to interrupt their pattern. The answer that they just gave you when you asked is not actually their real answer. And you'll see this in a second. What's happening is there's a story that they've associated with that pain. There's something that they feel that pain means to them. Very often there's a secondary gain that they're getting out of that. So they're going to play this pattern. That's what we did in step number 1. We got them to fire off this pattern. And number 2, so we want them to interrupt this pattern. That's what we did in step number 1. We got them to fire off that pattern. Step number 2, we got them to label it, put a quantity on it. Now, number 3, what we want to do is interrupt that pattern. So to do that, we're just going to take whatever they give us. Let's just say on a scale of 1 to 10, they said the pain's a 9 right now. Just going to say a 9. So it's pretty intense. You're kind of feeling it right now. Whatever they give you, they're going to give you back their personal buzzwords. I want you to notice what those are and repeat those back to them. So if they say, yeah, it's like this dull pain or a shooting pain or a noshing pain, however they happen to describe it, use those words, repeat it back to them. And then we're going to ask them to simply move. This is step number 3. This is the beginning of interrupting the pattern. So we're just going to say to them, if they're standing as you're doing this, maybe they've just come into your treatment room, you can just get them to move. And you would simply say, do me a favor. Would you stand right over here and face me? And as they're moving, you may say to them, could you put your feet just a little bit closer together? Or if they're already close together, maybe a little bit further apart. We're not trying to make them uncomfortable at all. In fact, if anything, we're trying to increase their comfort, but we're also getting them to move. We're beginning to shift their attention, and we're beginning to see exactly how compliant they are. So the more detailed the instructions that you can give them to a point, the better off that you're going to be in terms of moving them around. So once we've got them in a place where we like them, we've moved them around a little bit, we want to just do a quick check. After we've gotten them to do 2 or 3 things, just look them dead in the eye and say, now, where's that pain? So, assuming they gave you the 9 before, which is going to be our assumption, one of 3 things can happen. It can go up. It could be a 10, 11, 12. Many people report beyond the scale. It could remain unchanged and still is a 9. Or it may have gone down. Just the movement, there's a good likelihood that it'll go down. So that's step 3, interrupting the pattern. Okay, so that's step number 3. Step number 4, now we're going to start to move that around a little bit. So their response could have been stayed the same, could have gone up, could have gone down. One of 3 things. We're only interested in one, but we don't really care which one that we get because we're just going to work with that regardless of what it is. Now, here we're going to do a little something different based on the answer that we get back. If it's gone down, we're just going to validate that and say, wow, that shows me just how powerful your unconscious mind is. We're validating the fact that their mind does have the ability to shift things, to direct our attention. That's a good thing. We do want to validate that. So we could say something to them along the lines of, wow, look how powerful that is. Just from really taking a look at it and having the desire to move that down, you were able to make that adjustment. And we haven't really gotten started yet. Very cool. Second option is it may stay the same. If it stays the same, that's typically a reflective response, and it generally, maybe even beyond generally, it almost always means they really haven't checked. They're not giving you an accurate thing. That's just their conditioned reflexive response. So there we want to interrupt things a little bit. We said, stop. No. What I want you to do is really check it. Go inside and just notice, where are you right now in this moment? And then see what the answer is. If it is still the same, we'll say, okay, let's see what else we can do in just a second. It may go higher. This doesn't happen a lot, but it does happen. And generally what it is, if they're experiencing pain and we get them to focus on the pain, if they were somewhat distracted, maybe they weren't particularly feeling it. I mean, we've all had situations where our leg, our arm, our back hurt for some reason, but maybe while we were watching a movie, or maybe while we were reading a book, or listening to a concert, or even doing a little work at our office, whatever, we didn't really experience the pain. But then we got up, started to leave, and boom, all of a sudden it comes rushing back again. Well, what happens? We directed our attention, or something directed our attention for us onto that pain, and it may be these questions. If you get that, just take it and run with it. Go, wow, okay, so you can see the power of shifting your attention and becoming aware. In this case, it didn't go the way that it wanted to, so let's do some additional work and see if we can get that to go in the direction that we'd like it to. Does that sound good? And hopefully they're going to say yes. If not, if they say no, just move on to whatever else it was that you were going to do. So next we want to do something a little different. Get them to take a couple of deep breaths. Virtually everyone on the planet could benefit from breathing deeper, more regularly, and just becoming mindful as they're taking those breaths in and out. So just have them take a couple of deep cleansing breaths in and out, maybe 2, possibly 3 cycles, just kind of see how that's going. And now we're going to start to employ some other than conscious communication. We pick up things all the time. I don't know how they figure this out, or where these studies come from, or even if they're remotely close to being accurate, but I've seen studies reported that there are 100 to 200,000 stimuluses that are coming at us in any given moment. The vast majority of 99.99% of them we're just eliminating. We're not really taking them in. There's no particular need for us to be paying attention to that. But the sentries are still on guard. We're watching all of that stuff. So we're going to use some other than conscious communication to help them achieve even greater movement through a nonverbal suggestion. So after they've taken those couple of cleansing breaths, we're going to say, okay, now really I want you to fully scan your body and notice not only what is painful, we do want to pay attention to that, but we also want to notice those parts of our body that are not in any pain and are feeling actually wonderful right now. So as you scan that and really fully consider it, stay present as you're doing it, on a scale from 1 to 10. 1 being pure bliss and ecstasy. You're not feeling any pain at all. You feel phenomenal. 10 being you're in so much pain that you're basically curling up in a ball in a fetal position trying not to move because you have a deathly fear that any movement is going to cause you drastic pain. There's our scale. Where do you feel you are on that scale right now? Now, that example that I gave you was painfully obvious, way more obvious than what you needed it to be for the purposes, and way more obvious than what you need to do with your clients when you're going through these protocols. But what we're doing is setting 1, setting 10, and giving them the unconscious suggestion that their pain is currently around a 4 or 5. We're not telling them that, but their brain is picking it up through their peripheral vision. They can see that, but it's like so much of that other information that we get at any given moment in time. Most of it just gets deleted, never makes it into conscious awareness, but it's slipping into that unconscious mind as we go there. So then we're going to ask them where they are. They're going to give us an answer again. And we're merely going to follow those same protocols that we did. It's either going to be higher, the same, or lower. We're going to kind of go with that, whatever they give us, just like we did the last time around. But then we're going to have to tell you what, let's take a couple of more of those deep breaths. And this time I'm going to layer in some hypnotic patter. These are just some suggestions of what they could be possibly feeling, what they could be thinking about, what they could be concentrating on. So as they take that deep breath in, have them take a deep breath. When it's all the way at the top, say, as you're breathing in, just feel all of that oxygen coming in. Food for your brain and your muscles to help you heal and to accomplish everything that you want. And as you're breathing out, just allow all of the stress and strain of your day, your week, your month, your year to just gently melt away. Inhalation comes back in and again, bringing more of that oxygen. Feel it filling up your lungs. Now, if you want to take it to the next level, here's a physical thing that you can do, and that's move a little bit closer as you're giving them their suggestion. This is a particularly good idea for somebody who's experienced no movement or their movement has gone up. And we want to get to that point where we're invading their space slightly. If the point at which they're going to push back going, whoa, dude, you're a little bit too close to me. If that happens to be right here, we want to come up pretty close to that, but not right there. So that's something that we learn to calibrate. But what happens as you're doing that is you're absorbing their attention, particularly due to the fact that we're slightly invading their space. What's going on inside their mind, if our space is slightly invaded, just enough for there's a slight discomfort, not close enough that we generate the recoil, the mind's going to be going, what in the world's going on here? What's happening? Why is this person so close to me? What that tends to do is fixate their attention on what it is that we're saying. So as we're going through our hypnotic pattern, as they're breathing in and out, up and down, and we're talking about oxygen filling the lungs and spreading to every cell of their body, delivering nutrients, removing waste. And with each exhalation, all of the stress and strain of your day, your week, your month, your year, all that spent oxygen is just being released from your system. That space invading has the tendency to get that message accepted just a little bit more completely, didn't it? So at this point, you can check again and see that it's come down. And I would transition Once you got it down a couple of levels or gone through the exercise, whether it works or not doesn't really matter. Now we're just going to transition to whatever it is that they're there for, your normal healing modality. Here's a couple of notes that are worth considering. One is, first, as I said earlier, you can do no harm with this. It's not going to hurt anybody. Taking a few deep breaths with some suggestions to relax and allow your pain to decrease slightly can't hurt anybody. That's going to benefit everybody. And it's much more likely to put them in enough of a relaxed position that the work that you're going to do with them is likely to become significantly more effective. Second thing is, we're not trying to remove the pain. We're not looking to get it to go down to zero. When we teach pain hypnotic protocols in a formal classroom, that's one thing that I stress very, very completely, because the pain is there to deliver a signal that something is a little bit off. So you can imagine a scenario if somebody came in with tennis elbow and you were to take them through pain protocols and remove that pain completely and permanently, and whatever was the underlying cause of the discomfort in the elbow, the tendonitis or whatever it happened to be, was not cured, what are we going to end up doing in that circumstance? We are going to end up doing, in all likelihood, a lot more harm than good, because they're not getting the signal from the body that's telling them, hey, you shouldn't be using your elbow in this repetitive motion right now. You've stressed it out, you've overused it, and it hurts because of that. It needs a little bit of time to heal. If they're not getting those signals, then that's not good. But what happens with people, particularly that are in any type of chronic pain, they are constantly carrying with them the memory of sharp, shooting, powerful pain that may have happened to them a few minutes ago, a few hours ago, a few days, or even a few weeks ago. That's still there. That's the reason they're walking on eggshells. What we want to do instead is use this as an opportunity for pain management. As long as the signal's there, it may not have to be as intense as it is right now. The body may be over-communicating that message to us. But the other thing that we're doing is introducing the client to the power of their unconscious mind. And we're enrolling it as part of the healing process. So we're taking that placebo effect that just by giving somebody a sugar pill and telling them this is going to make it feel better, we know 30 to 35% of the people are very likely to report they're feeling better because of the sugar pill. And by showing them the power of this and enrolling that as part of the healing process, we're opening doors to a significantly healthier, holistic approach to wellness. Hope you've enjoyed it. I'd like to hear what kind of results, what sort of success that you have with that. Thanks for watching the video. Bye-bye for now.